My name is Dr. Tara Houlihan. I'm a senior clinical psychologist with the Psycho-Oncology Service at the Mercy University Hospital. I work with patients with cancer and their families. In this video, I'm going to talk about how a diagnosis of cancer can affect a patient's psychological well-being. For example, how it can change how you feel, think and behave, and other changes you might notice after hearing the news. In the next video, Coping with a Cancer Diagnosis, I offer tips and techniques that may help you to cope, and I encourage you to watch both videos to get the most benefit. At the end of this video, I will also suggest some resources for further reading if you're interested. Receiving a cancer diagnosis is a major event in the life of any person, and it can be challenging to cope with. The effects of cancer, both physical and psychological, are very individual to each person. Not everyone is impacted in the same way or at the same times. There are different psychological issues that can confront people depending, for example, upon where the cancer is, whether it has spread, treatments, their side effects, and so on. Your own past history and current resources, both personally and socially, are also very likely to have a bearing on how cancer impacts on you. Remember, everyone is different and responds differently. But some or many of the following changes I will mention will be familiar to some of you. We hear from some patients that their whole world was turned upside down on hearing the news. Almost everyone who is told they have cancer will experience a period of shock or psychological distress. For the majority of people, this does not last long or cause any lasting psychological problems, and it can be understood as part of a normal adjustment reaction. In other words, this is how we would expect an individual to respond. Common concerns we come across at this stage include fear of losing independence or freedom, worry that people may treat you differently, maybe worry about your job and money, concern about changes you may have to make to your lifestyle, and so on. People can also have the thought, I am going to die, which may not have entered their minds before this time and can be frightening and upsetting. These are very real concerns, and it is understandable to worry or feel upset by them. People commonly experience a range of emotions after receiving a cancer diagnosis. This can include shock or feeling numb, disbelief, anger, fear, a sense of powerlessness or loss of control, sadness, and so on. For example, it might be hard to believe you have cancer on hearing the news. You might have thought, this can't be true. It must be a mistake. Patients can feel angry and wonder, why me? Why my body? Why now? Some people feel scared, mixed up, and overwhelmed. For most people, these feelings do not last long. Indeed, some patients tell us that they feel lucky to be alive and find a positivity within themselves they did not know was there. For some patients, it can be at the stage of treatment that they face most difficulty. You may be experiencing a range of effects related to cancer, some of which may be severe, and you might be enduring aggressive or difficult treatment. You might experience side effects from chemotherapy or radiotherapy, for example, including fatigue, nausea, vomiting, constipation and/or diarrhea, and so on. And this can impact your everyday life and be difficult to deal with, especially because for most people, they've not had to live with these symptoms before cancer. People can be vulnerable to emotional distress during this time. And it's important to tell your medical team how you're feeling so that they can do their best to support you through treatment. For some people, psychological difficulties can arise much later when they come to the end of treatment. At this stage, you may have other fears and emotions. For example, you might feel isolated, lonely, and afraid that you're no longer attending the hospital, except for follow-up visits. It can feel like you're on your own because your doctors and nurses are no longer there to check in with you and support you. You might worry that the cancer will come back. As a result, you might be nervous about every ache or pain. You might also be anxious about getting back to normal life, for example, going back to work or dealing with things that have been put on hold during your illness. This is again very normal, and gradually these fears should fade and go away. A sense of uncertainty often characterizes the cancer journey for patients, and this aspect can make people feel anxious and fearful. As human beings, we find it difficult if we do not know what to expect. And often not knowing can feel worse than knowing, even if the outlook isn't positive. Understandably, a common concern patients with cancer report is a fear of the future and what that might hold, which is not possible to predict. This sense of uncertainty can lessen when things are going well, but often it never completely goes away. I often discuss with patients that learning to live and cope with uncertainty is the bottom line in learning to cope with or live with cancer. Patients with cancer often experience anxiety during their journey. Anxiety can range from feeling nervous or mildly anxious to intense dread or panic. It can be constant or it may come and go. Symptoms you might notice include worrying thoughts, for example, about whether treatment might work or not. You might also notice physical sensations in your body, including maybe shortness of breath or breathing very quickly, dizziness, feeling hot or sweaty, maybe shaking, increased heart rate. Nausea and loss of appetite can be symptoms of anxiety also, which are also side effects of treatment, such as chemotherapy. A common reaction to anxiety is to avoid situations and people. For example, you might make excuses to avoid going out with or meeting your family and friends. You might also find yourself more irritable with others, moody, fearful, or easily upset. And it is important to note that anxiety is a natural response to a stressful situation, such as cancer. And it's commonly evoked by scans or other medical tests, maybe meeting with your consultant to receive the results of scans. Most people adjust and learn to cope with anxiety during their illness. Some patients with cancer also experience low mood or depression, which can affect thoughts, feelings, and the ability to function in everyday life. Depression can occur alongside or separate to anxiety. And with depression, you might notice that your mood has been low and you've not felt like yourself for several weeks. You might notice a tendency for your thoughts to be quite negative. For example, maybe expecting the worst to happen. You You might notice loss of pleasure and interest in your favourite activities, reduced motivation or desire to go anywhere or start or finish tasks, changes to your sleeping pattern and levels of concentration. Physical symptoms to watch out for include lack of energy or fatigue, loss of appetite or increased appetite, weight loss or gain, loss of interest in sex. And again, some of these symptoms may be caused by cancer or its treatment. There are other changes patients notice during their cancer experience, which include wanting to be left alone at times and withdrawing from people. Changes in maybe how you feel about yourself and how you might view your body. Patients often tell us they find themselves worrying for how their diagnosis is impacting on their family members, such as their spouse or partner and children. You might find yourself questioning views or beliefs you may have had before cancer. Some patients find a change in their life preferences, possibly leading to new life goals or wishes, for example, in relation to family or career and so on. For some patients, cancer and its treatment can affect intimate relationships and sexual functioning. If you are struggling with anxiety or depression, or indeed another psychological difficulty as a result of cancer, it is important to share this with your healthcare team, who will signpost you to the most suitable supports for you. We now have a psycho-oncology service in the Mercy University Hospital, which consists of a clinical psychologist who supports patients with cancer and their family members. In summary, cancer can and often impacts on the psychological well-being of patients and their family members. Following a cancer diagnosis, you might notice changes in how you think, feel, and behave, and other changes, all of which will be unique to you and can be difficult to cope with. It is important to realize that these changes are a common, normal response to a potentially life-threatening illness. Be kind to yourself. This is an enormous experience to go through. There are resources and supports available to you during this time. And it's important that you let your medical team know if you're experiencing difficulties. I will talk to you in the next video about coping with the impact of cancer using self-help techniques. I will also talk about when to recognize when you might need to meet with a professional, like a clinical psychologist, to help you to manage. If you are interested in further reading, I have included website addresses for the Irish Cancer Society and Macmillan Cancer Support.